I am very happy to introduce you to the new safety isolation bags, which are very simple and easy for in-bag morcellation. We have 4 different sizes of safety isolation bags available for in-bag morcellation, which are 1800 ml, 2500 ml, 4200 ml and 5000 ml. I'll just show you how simple it is. Now, the safety isolation bags are coming as a pre-rolled bag, so you don't require to roll it during the surgery with your wet gloves, so that you can save at least 5 to 10 minutes of your surgical time. Now, always see that you hold your morcellation bag, safety isolation bag with your right hand, and you can see a paper tag over here with an arrow mark here. This is an arrow mark here. So just hold below the arrow mark on the bag, and just using your left hand, just remove this tag. And see that after removing the tag, you are holding exactly at the same place where the paper tag was. Now the second thing is, after widening the morcellation port, please consider that if you are using an 18 mm cutter blade or a 15 mm cutter blade or a 12 mm cutter blade, depending on the size of the incision which you made, consider the thickness of the bag. Just to widen, use your artery forceps or an instrument, just stretch the incision little bit so that very easily the bag will go and the morcellator also go through the bag. So after the incision is widened, just insert the bag into the morcellation port, and with a clockwise forward pushing, insert the bag as much as possible into the abdomen. Imagine this much is gone into the abdominal cavity. Now little bit of the bag is still outside and the introducer is outside. To remove the introducer, it is very simple. Hold here on the white introducer, that's still at, and just give a full anti-clockwise rotation. Then by giving an anti-clockwise rotation, keep pulling it. The introducer will come out very easily. Once that is done, with an atraumatic grasper, always as you do with an atraumatic grasper, pull the bag fully into the abdomen. Now imagine the bag is fully inside the abdomen. Now see that the bag has 2 layers, or the one is an anterior layer and a posterior layer. The posterior one is with a black color. You can see a black color here. So with your one of the instrument, just hold on to the posterior black layer, okay, and you can see a ribbon-like structure here. This is the tubular guide with this marking, okay. And to open the bag or the unroll the bag, it's very simple. Too simple. Just after holding on to this ribbon or the tubular guide, just pull it backward. The bag get automatically opened, or very easily it get opened, unrolled. Also you can see once the bag is unrolled, the mouth automatically gets opened here. See, the mouth is automatically opened. So that however big the specimen, very easily you can place into the abdomen. And once the bag is unrolled, what you do, you use with the same instrument, just pass it inside and stretch it, so that the full bag get opened well. Once that is done, suppose imagine this is the specimen which you want to morcellate. See that the specimen is inserted or pushed fully into the bag, as much as possible inside the morcellation bag. Once that is done, the next step is very simple. Hold at one edge of the bag with an atraumatic grasper, okay. Go through the morcellation port. And hold at any one edge of the bag. Once that is done, just pull the bag in such a way little bit of the mouth of the bag is being brought out at the morcellation port. Then open the mouth like this and edge by edge. See that the mouth of the bag is being pulled out edge by edge. So that what happens, uniformly the mouth comes out, keeping the maximum of the bag inside the abdominal cavity. Our objective is to keep the maximum of the bag inside the abdomen so that you get better working place. Here you can see already there is a marking, blue line marking there. It's mentioned that pull until here. If you pull until there only, you have maximum bag inside the abdomen, so that we get better working space. So once the mouth of the bag is been brought out at the morcellation port, you can just put a clamp there and keep it there. Now the next thing is, we need to bring this tubular guide or the telescopic channel out at the primary port, where we need to pass the 10 mm telescope. 2 ways you can do this, either by using a 5 mm telescope at the side port. By inserting a grasper through the primary trocar, we can bring this tubular guide outside, or by railroading it. Whichever is convenient to you, that method you can use. The point is you can see here there are 3 arrow marks here on this. So all the 3 arrows needs to be brought out at the primary port, at the incision. Once at the primary port, we need to bring out all the 3 arrows. That means, see, you can see this, the anterior wall of the bag is in contact with the abdominal wall, so that no way the bag can get twisted. Most of the time, this is what doctors face while trying to insert the telescope. This area gets twisted and it struggles you. Here, because the tubular guide or the telescopic port is welded onto the anterior wall of the bag, this is been brought out. You can see a cut mark here. Just keep a little fold here and just give a small cut there and pass your trocar and telescope now through here. See that the telescope is gone ahead of the trocar, such that otherwise if the trocar goes first, the tip of the trocar can go and damage the bag. So always see that the telescope is ahead of the trocar. Once the and you can go with the gas and the light on. Once the telescope is gone inside, you will see the specimen inside. Then you try to slide the trocar over the telescope into the bag. Once the trocar is gone inside, then with every bag there are 2 threads given, cotton threads given along with the bag. So one of the thread you can try outside the trocar and the bag tubular guide, so that while trying to remove this or clean the telescope occasionally, the trocar will not come out. Okay. Now through the morcellation port or the mouth of the bag, you can insert the morcellator with the introducer. Always see that you insert the morcellator handpiece with the introducer, not directly with the cutter blade. Otherwise the bag can get damaged. So with the introducer or the obturator, you pass the morcellator handpiece. Once that is done, the second thread you can try outside the morcellator handpiece and the bag, so that absolutely it become a leak-proof system. Okay. Then remove the introducer and pass the cutter blade, and you can do the morcellation under vision. And you can give a continuous airflow, so the gas flow, so that the bag will be inflated. And the most important thing is, since we are going to do the in-bag morcellation, all the organs from the field of morcellation that will be moved away, so that it will be absolutely safe. Okay, and the chance of secondary and parasitic fibroids will be absolutely nothing. So once the morcellation is done, what do you need to do? Remove the trocar, remove the thread which you tied there, and remove the trocar and telescope. And since we made a little cut here, we need to make a small knot just below the cut you made onto the tubular guide, so that from that little hole the fluid and the species can fall into the abdomen. Now once the specimen is been fully removed after morcellation, now through the same morcellation port or the mouth of the morcellation port side, you will remove this bag like this. So the entire bag is been brought out. Now you can see this, it's a very simple procedure. The procedure is simplified in such a way that the insertion is easy, the unrolling of the bag, the opening of the bag is easy, and the mouth get automatically opened, so that any large size of specimen you can do in-bag morcellation. In-bag morcellation is made such a simple procedure now.